Oral health is a key indicator of your overall health and that of your child. Children who have poor oral health usually have problems with their communication, eating, playing, among other issues. Tooth decay or dental cavities are one of the most common infections in children. The good news is oral disease are largely preventable, and keeping the children's teeth healthy should be a goal of every parent. Tonight on Health Check, you will be learning more on healthy habits you can establish with your child that will help boost your child oral health. We have in studio Ruth Gasheru Mungai, a dental specialist, live in studio to take us through the topic dental health and hygiene in children. Please start sending in your questions you have regarding today's topic. Our SMS line is 22232. Good evening and welcome to Health Check. My name is Grace Mutiso, as always, an honor and as joy to serve you. Allow me at this point to invite Ruth. Good evening, Ruth.
Good evening.
How are
Grace.
you doing?
I'm fine.
You know, the first thing that struck me when you walked in here is your dental formula.
The smile.
The smile.
I am an advocate of healthy, beautiful, and long-lasting smile.
Yes.
Yes.
It's something you purposed. This
Yes.
one is a must.
Oh, it's a must. I
And
do
it's
that.
achievable.
And it's passion.
Yes.
And it's career.
Yes.
So it's where career meets passion. And I love it because we help people to understand and to know what to do with their oral health.
Yes. Karibu sana.
Asante.
So let's start by defining what is dental and oral health, especially in regards to children.
Okay. Dental, when we talk about dental, I know most of the people think about teeth.
Yes.
But amazingly, dental is teeth, gum, cheeks, lips, everything that includes in the mouth or is all inclusive in the mouth. But majorly is all about teeth. So the components that make the dental components, number one is teeth, which we have different types of teeth in the mouth. In children, we have 20 teeth. I always say, imagine God, how he was so careful while creating teeth because he created 32 teeth and each teeth has a function.
Yeah.
Amazing.
Yeah.
Amazing. The detail in that, you know, when you are a doctor who deals with teeth and you get to the teeth, you will see that every tooth has a different shape and different function. That's amazing, isn't it?
Yes, it is.
And I think one thing that I keep telling people is because it was so detailed and each teeth has its own function, you need to take care of them. Yes, of your teeth, because if you disrupt the creation of God, you disrupt the function. So basically, dental, that is the mouth, the tongue, and the gums. Yes.
You know, you mentioned the cheeks, and I'm like, wow, it's also part of that.
Yes.
How come? I never thought of I never thought of that.
Yes.
How is it important when it comes to the cheeks? At least the lips we know, the mouth we know,
Yes.
the tongue we know.
Yes.
The cheeks.
You see, if you don't take care, for example, of your jaws,
Yeah.
and you extract some teeth, yeah?
Yes.
You see the way you look good? Just extract 5 teeth. You know your jaw will collapse and the cheeks will sag. So the teeth helps in maintaining the physique of the cheeks, the way the cheeks look like.
Yes.
Yes.
So they are really
They are all connected, imagine.
Okay.
Yes.
God is amazing. And what's the link between children's oral health and their general well-being?
You see, if we come to talk about teeth, number one, the function of teeth. The one people know and the basic one is eating.
Yes.
Yeah. So if the children's teeth are not intact or that child has diseases, maybe talk about cavity, what will happen? They will not be able to eat well.
Yes.
So that affects their nutrition. And they may end up getting diseases that affects their nutrition or malnutrition, something like that. So they may not be able to eat well. So that's number one. Number two, teeth gives you good confidence because the other function of the teeth is speech, gives you good confidence. So if your teeth are not in good shape, for example, a child has teeth that maybe are not aligned. that really takes their confidence down. They have this low esteem. I don't know whether, Grace, you've ever seen a child or anyone, not even a child, even an adult, and when they are speaking, they just cover their mouth.
Yes, or they look
Yes,
down.
or they
don't
look
that
down.
eye-to-eye contact.
Contact. It's because their teeth are not intact. And you realize when you look at yourself in the mirror, the first thing you see is the teeth.
Yeah.
So this connect a lot. So if they are not intact, you realize they will erode a child's confidence or esteem. Yes.
Okay.
Yeah.
And you were mentioning a child. That means there is something that a parent needs to do when this child are really tiny or
Yes.
small.
Yes.
So as to help them have healthy teeth. What are
Yes.
some of these things that a parent needs to do or a guardian?
The things that a guardian needs to do is, one, we need to know when the teeth are supposed to come out, especially for a toddler, because if they don't come out the right time, that's where now we get what we call malalignment or malocclusion. So this is what causes now teeth, some are in, some are out, because the teeth were not removed in the right time. So that's something that parents need to check. And we are in this busy era. So sometimes we are not even in terms or in view of what our children are doing concerning their teeth. So by the time you're realizing, other teeth have grown above others, you know. So it's good to know. And if we can talk about it, at around 6 months, that's when the first tooth of a child is supposed to come in the mouth.
The upper one or the lower one?
The lower one.
Okay.
The two
Yes.
central incisors, the lower ones.
Yes.
But I don't know, it's a generation where we are. I think things are rushing. Sometimes you can get even 4 months. Like I think my children, teeth came in the mouth at 4 months, you get.
Wow.
So 4 months, we can say 4 months to 7, those who delay, or even others 8, especially boys delay, you can get that their teeth have not yet erupted. That's the milk teeth I'm talking about.
Yes.
So at 7, they go increasing, so they get from the central incisors, they go to the upper ones, the central incisors, they go to the lateral incisors, just like that, adding until we get 20 teeth in a child. Now, what happens is that at around 6 years is when now the first tooth is supposed to fall off. And now we get the permanent tooth.
At 6 years.
Yes, at 6 years. So sometimes you can see other comes early and other delay.
Yes.
So just depending with the mileage of the child and the milestone the child is taking. Some go go with the time, others delay, depending. So at 6 months, the first tooth now goes off and the other one sets in. So if you delay and that tooth shakes and you didn't shook it the right way or the right time, what happens? Another one sets in.
That is at 6 years.
Yes.
So you delay, you don't remove it,
Yes.
another one grows.
Yes, yes.
So what's the danger of that?
What happens in that is that when you don't remove them, now they get malaligned. So you get others are growing while others are still in the mouth. And when we don't remove the right time, the ones that are supposed to go, because of that space is limited, so you get maybe they are growing in the wrong places where they are not supposed to grow.
Yeah.
And when that happens, you realize as the child grows, because those teeth are still in the mouth and maybe they are not in the right places, so as the child grows, when they become maybe of teenage, this starts affecting them.
Yeah.
Yes.
There is steam. I remember we talked about this steam.
Yes.
Okay.
Yes.
So one of the things that parents are really worried about their children when it comes to their dental health and hygiene is bad breath.
Yes.
So when a toddler or a baby has bad breath,
Yes.
what is happening in their mouth at that time, and what can be done to sort that?
Yes. What's happened in bad breath is like, one, their hygiene is wanting. Yes, their hygiene is wanting, and this is a good thing to talk about.
Yes.
When we talk about hygiene in children, for me, I don't fault the child. I fault the parent. And as I said in the beginning, we are very busy parents. And, in the society we live in, it's true, we are busy. And so we are not taking care of our children's teeth how they should be taken care of. And it's from the beginning. Most of the parents ask me, when should I brush my child's teeth? That's a good question, and a common question people always ask.
Yes.
And you should do that at 6 months.
6 months?
Yes. Immediately, the first teeth sets in the mouth.
So even how do you brush, A 6 months on is just still like a baby. And I'm
Imagine.
thinking, watch her grow up to a year, then
Yes.
at least there'll be 2, then I'll see how I can sort. At 6 months,
Yes.
how do you go around that?
What you should do, take a cotton wool,
Yes.
dip it in water, then squeeze the water out, and then make sure that you're cleaning or you're brushing that tooth all around. Because if you do not do that, and that child is breastfeeding,
Yes.
so at around 3 years, those teeth will be something else. As these teeth comes in, make sure you're brushing. At around 1 year, at least we have several teeth in the mouth.
Yes.
There are toothbrushes for children and toothpaste for children. 0 to 2 years, buy them and do them yourself. Until the child can totally brush their teeth by themselves. We always advise they do it from a supervision point. Yes. So now, if we don't do that, this bacteria that is in the mouth starts affecting the teeth,
Yeah.
or rather the gum also. If the teeth are not affected, you can see the gum being affected. And when it's affected, now we have this bad breath. Yes, so that's where bad breath comes from. Although bad breath can also come from, in children, can also come from other infections. Maybe you have some internal infection, from the GIT perspective, from tonsillitis, all that can cause bad breath. But the most one, or the most important one in this case, is the one that comes from lack of good hygiene or improper hygiene.
Okay.
Yes.
I know you're watching, dear parent, and you're wondering, wow, when is the last time I brushed my
Yes.
6 months old
I know.
their teeth? So if you're in that WhatsApp group, please do something tonight
It's true.
before they go to bed. And if you have any questions regarding your dental health and hygiene in your child or children, please do not hesitate. Our SMS line is 22232. That is 22232. And of course, our specialist, our dental specialist, Ruth Gasheru Mungai, will be glad to answer all your questions. Remember again, 22232. The number is right at the bottom of your screen. So you've talked about bad breath, and as parents, we have agreed from tonight we are brushing
We're
their
brushing.
teeth.
Yes.
Another thing that is really common, tooth decay and cavity
Yes.
in children.
Yes.
So where does that start? And I've kept away the sweets, I've kept away the nice things,
Yes.
but still they get cavity.
Yes.
What happens?
From this point of, we didn't do the cleaning the way it's supposed to be done, so these bacteria become active in the mouth.
Yeah.
So when this bacteria combines with food particles, it forms what we call a film or an acid that attacks the tooth. So when that structure of the tooth is attacked, now it develops to a dental caries or cavity. So that's what we call dental cavity. Grace, amazingly, this cavity will not pain in the first stage. Yeah? It will not pain in the second stage. And even in the third stage, it will not pain. But in the third stage, you could feel some sensitivity. But now in the fourth stage, now someone has pain. So what I'm saying is that if you are able to be seeing your dentist at least once or twice in a year, we're able to do checkups. That's why we insist on checkups. So in these checkups, we are able to see now the teeth. If there is this cavity that is forming in your teeth or your child's teeth, we can detect it in the first or second stage.
Yes.
Or the third stage. Before now, it becomes painful, And when it's painful, now imagine seeing a child 2 years or 3 years old having sleepless nights because of toothache.
Painful.
And Grace, toothache is something else.
Yeah.
You know, it's not a pain that you can bear, and you say like, let me just, bear this. It's pain and severe pain. So I'm imagining this child, and I've truly seen. Actually, personally, the reason why I'm so passionate about oral health awareness is because I have seen children 2 years old with gross caries, 3, 4, 5 teeth in the mouth. And I'm wondering, how is this child eating?
Yeah.
Is even this child enjoying life?
Yes.
What's happening to them?
Okay.
And the pain is immense. So what we are saying is that from the point of hygiene,
Yes.
to the point of visiting a dentist is very, very crucial.
Okay.
Yes.
From point of hygiene to
Yes.
visiting a dentist
Yes.
is crucial.
Yes.
I want us to take a quick break. When we come back, I want us to pick it up from there.
Okay.
How often should I bring this baby? How soon should I start?
And how often
bringing
should you
the child
brush?
to bring and how to brush?
Yes.
Keep it right here at Hope TV. Look and Live. This is Health Chick. My name is Grace Mutiso. I'm hosting Ruth Gashero Mungai, a dental specialist, helping us discuss dental health and hygiene in children. Any question on 22232? We'll be right back.
Hope TV has continuously provided you with life-inspiring Christian content. Our content offering is suitable for the whole family viewing, with Christian programs tailor-made for children, the youth, and adults, satisfying everyone's needs. We are glad to announce to you that Hope TV now broadcasts 24/7 on our website www.hopemediakenya.org, so you can catch all your favorite programs wherever you are. That's www.hopemediakenya.org to watch the Hope TV live stream. Hope TV, look and live.
Welcome back to Health Check right here at Top TV Look and Live. My name is Grace Mutiso. We are talking about dental health and hygiene in children, and I'm hosting Ruth Gashero Mungai, a dental specialist, and we're looking forward to interacting with you. Our SMS line is 22232. Any question you have regarding dental health of your child, drop them on that SMS line. We'll be sampling them in a short while. Welcome back, Ruth.
Thank you.
You post us at that point where we must see a dentist.
Yes.
Take
Yes.
our children and brush our children's teeth as early as 6 months when the first tooth comes out. So, how do I brush? Yes, of course you told me, but what's the right way now for children over 6
Yes.
who need to use a toothbrush?
Yes.
How do we brush our tooth properly?
Yes. I want to start from this point, of what our children are taught in schools. There's this song that they are taught that when I wake up in the morning, I brush my teeth, I take a cup of tea, then I run to school.
Yes,
I think
sang
that's
that
the
one. Can you imagine?
You know it, I'm sure.
Yes.
And the first mistake get in there, right there, because we are teaching our children that we should brush our teeth before taking our breakfast. Yeah, I don't know how we'll change that, but I think it's something that needs to be worked on, because what should happen, we should brush our teeth after breakfast. Yeah, then brush again before bed. The reason why we insist in those 2 times is because when you take your tea and you go away, the bread that you've taken or any other thing that you've taken in your breakfast go acting in your teeth.
Yes.
Or on your teeth, okay? So if you don't brush your teeth, so what happens? The bacteria that we were talking about are active and they start acting on your teeth. Again, number 2 is night. I don't know, most of the time we tend either to forget or we are lazy to or we don't know the importance of brushing our teeth at night. Yeah. When we do brush our teeth at night, what we do, we prevent our teeth, because at night when we are not active, we are asleep, the bacteria are active. And that's why you'll get, most of the people get toothache during night.
Yes.
I don't know whether you've noted that most of the people have toothache during
the night.
Because at night the bacteria are active. That's why we need to insist on that.
Yes.
While doing my training, I tell them, you'd rather forget to cover yourself with a blanket, but make sure that you brush your teeth. So parents, if you're there, before your children, let them know that it's important for them, to brush their teeth at night and take it as a personal responsibility. Yeah, let those habits be with them, in them, We have to talk. I'm saying, Grace, I have to talk about this until when those children, when you go to bed without brushing, you remember, she said about brushing our teeth at night, Because if we brush at night and in the morning, because when we say 3 times, maybe it's not practical that we can do it during the daytime. But if you can, please do. After every meal, you can brush your teeth, but at least insist in the morning and at night.
Yes.
That's very important. So that's number 1 in taking care of our teeth. So brushing morning, night, then how? Yes, we need to brush our teeth the right way. There's the right way of brushing. But before I go to the right way, we need to take 3 minutes, at least, while we are doing our brushing. 3 minutes, yes.
3 minutes?
Yes.
Not 30 seconds?
Not 30 seconds. And I know most of the times we brush our teeth in a hurry. You're late at work and you're doing it as a by the way.
Go on.
I always argue with ladies and I'm telling them, you need to take more time to brush your teeth than the makeup. And the makeup time, take more time, do the brushing the right way. Of course, I'll show you how to do it the right way, but that's very important. The other thing we talk about here is toothbrush.
Yes.
How often should we change our toothbrushes? Yes, after every 3 months. Change your toothbrush. After every 3 months, change your child's toothbrush. Why are we changing our toothbrush? Because if you work with your toothbrush for the next 3-4 years, the bristles will wear out and you'll not be doing something, you'll not be doing work the way it's supposed to be, or the brush will not brush the way it's supposed to brush if you stay longer with it. That's why we should change our toothbrushes after every 3 months. The other thing I'll talk about that before I talk about how we should do the proper toothbrushing is that nowadays at least we have what are they called? Electrical toothbrushes that helps now make it easy in brushing.
Yes.
Because when we are doing the brushing, I'll show it with the model, we should do it in a circular motion. But this one does it. The electric toothbrush or the digital ones, they do that work for us, and it's more effective. So if you can grab one for your child, it makes brushing, easier, effective, and fun.
Yeah.
Yes, so those are the things we need to note. And there's another question people ask, what kind of a toothpaste should I use?
Yes, and the fluoride.
Yes.
Amount in it.
In it and all that. And for me, I think the most important thing, because, even earlier times, they didn't have even this toothpaste and all that. But their teeth used to be intact.
Yeah.
Why? Because they used to do more of the brushing. Your old mom and your old grandma would walk with a stick.
Yes, actually they pluck it from the
Yes,
fence,
yes.
chew a bit, and then
Yes.
and they stay with it for a
long time. By the time your grandpa is taking the cows to the water, or wherever they are going, they make sure that they have that stick and their teeth were throughout clean.
Yes.
What about us? You chew a biscuit and you keep going and you even didn't remember to brush your teeth. So those bacteria keeps acting on our teeth. Yes, and those are the things that predispose us in our today's life. So when we are talking about brushing our teeth the right way, if it's okay, I can demonstrate.
Please do.
So this being our mouth, you remember we said we have, for a child, they have 20 teeth.
Yes.
A child has 20 teeth. Though as they as they grow on, you realize the teeth keeps adding. So you can get a child has 24 like that. But an adult now, after all your teeth have grown, 32 teeth. Yeah. So when we talk about brushing, we have the upper jaw and the lower jaw. Then we have all our teeth. So we must make sure that we are brushing all our teeth, all the sides. Okay? So this is the way we should do it. We make sure that our brush is touching the gum at an angle. Not like this. Because when we do like this, we injure our gums. Yes, but at an angle so that you do it in a circular motion. So this angle makes sure that even the dirt, the food particles that are there in the gum where you can't see, they're able to remove.
Yes.
So we do it in a circular motion. And we say a tooth by tooth. You don't double brush your teeth because you'll not brush all the size of each teeth. Okay, so like this. You make sure that you're doing it in a circular motion. So all the teeth should be touched. Then after you're done with the upper side,
Yes.
you go to the inner side. Upper jaw, upper side, upper jaw, inner side.
side.
So do the same. Remember, we are doing it in a circular motion.
Actually, as you do that, I'm noticing you're also getting on the joints,
Yes.
like in between the two
Yes.
teeth.
Yes.
The brush is able to get in there.
Yes.
Okay.
That's why we said if we rub like this, we will not be doing a
can't.
good job.
Yeah.
Yeah. Then after that, there is the other very important part.
Yes.
The eating services. And this is where the bacteria attack first. Reason, if you can see, it has deep grooves and fissures. So food tends to hide there. So we make sure that we are brushing them. Put some energy a bit because of the deep fissures. Brush all of them. Then make sure this part we tend to forget. We brush it also, yeah?
Yes.
Then we do the same on the lower side. I know you are wondering where are our 3 minutes.
But if you go tooth by tooth,
Yes.
you'll get 3
Even
minutes or
more.
even beyond.
Yes, yes,
Yeah.
it's true. So we do it the same way. Okay. May I always tell people, take your time.
Yes.
Be keen with your teeth. You will live longer.
Yes. Yes.
Because healthy teeth.
Yes.
Yeah, healthy life. Yeah.
Yes.
So after we are done now with the teeth, they are well done and clean, we go now to the tongue. We make sure that we scrub our tongue.
Is there another a specific way to scrub the tongue?
Yes.
Can you do round or just any style so long as I've brushed the
You
tongue?
can brush it like this.
Okay.
But also you realize in your other toothbrush, it has something here that's called a tongue
Yes.
cleaner. And we also have tongue cleaners. So you just use it and scrub your tongue. Then after that, you make sure you also brush your gums. Softly brush your gums. Now our mouth is clean.
Yes.
Yes. The reason why I have this is called a toothbrushing timer. Because how will you time or how will your child time
Yes.
that they are doing the brushing the right way? So you can have this, it's a toothbrushing timer. You stick it where they are doing their brushing
Yes.
and it helps them to do it the right way.
What does it do? How does it exactly operate?
It's a sand dune, so these drops.
Okay. Once the sand is down,
You know you are
it's
good.
out
At least
or
3
you're done.
minutes you time
Okay.
yourself.
Oh.
And also let me talk about flossing also
Yes.
because it's very key.
Yes.
Remember, when we brush, we are not able to get in between.
Yes.
So we use a dental floss to get in between the teeth.
Yes.
And again, after we are done with that, imagine all that work, but we are reaching only 30% of our tooth. So deep there, you don't get it with your brush. That's the reason why we send you to the doctor or to the dentist for professional washing or cleaning.
Okay.
Yes.
How often should that be done?
After
I've had
every
myths
6
that,
months.
If you do it oftenly, you're weakening your teeth. Is
No,
that true?
no, not at all.
Oh.
There is no point that we touch the enamel or your tooth. We just do away with the tartar that forms
Okay.
when you eat food and have that dirt in your mouth.
Okay.
Yes.
Is that cleaning also because you're focusing on children?
Yes.
Is the cleaning of tooth applicable to children, and how is that
Yes.
done?
Yes, actually, you'll notice that in developed countries, at 1 year or so or 2, children should, and it's a must, to be taken to a dentist for that hygiene cleaning. Helps a lot because the doctor is able to get in the deeper parts of your mouth, of your teeth, where you cannot get with a toothbrush. Yes.
Okay.
Yeah.
Thank you. Thank you. That's clear. I believe my viewer now you have an idea of how to brush your child's tooth.
Yes.
And also yours.
Yes.
If you've been doing it the wrong way, now you know how to do it the right way.
Sure.
So what are some of the signs that a parent should watch out for that should worry them and let them know their child has a dental issue and they need to take them to a dentist as soon as possible?
As soon as possible. Well, you may not know, especially when the caries and those diseases are in the first stage. That's why we are insisting after every 6 months or once a year, make it a routine to visit a dentist. Before we have issues, we can able to detect them and maybe prevent and protect and treat if they are. But one of the ways to notice that you have issues, if you look at your child's teeth and you realize they are just changing color, maybe from white to yellowish, creamish, just know that we are having tartar. Tartar is something, if I scrub like this, I would remove, area of it. So that's one sign that tartar is in the mouth. So immediately take your child to the doctor and they will get their teeth done their cleaning. So that's number one. Number two, if they have sensitivity, if a child complains of sensitivity, maybe they're taking something cold, and sometimes they may not know, but you can tell a child, take something cold, and they kind of cringe, like you can realize something is happening. That's a sign that something is happening. And of course, the other one is pain. At this stage, even the child will say, or most of them, they may not say, but they avoid eating with that side. You realize when your child is struggling eating or they don't want to eat with that side, just know that there is a problem in that mouth. So take it to the doctor and we will be able to sort this. Maybe in advance, even before it becomes severe, because we said most of these teeth issues, gum issues, they can be prevented in young stages. Yes.
Okay.
Yeah.
And then how are these the cavities treated in children?
Yes. So when we have cavity of grade 1 or stage 1, stage 2, we do fillings. There is what we clean that decayed part, then we fill it with a material, we call it a filling material, different types of them. Then if it has gone deeper and the child has pain or the tooth is paining, we remove the nerves of that tooth. Then we just make sure that that part is well clean, then we fill it up. So that's what we call basically a root canal, or in children, we have pulpotomy and all that. So we just make sure that that decayed nerve is out of the teeth, yes. So that's one way to treat that teeth decay or that. But if they are not so bad, we insist in hygiene. Just make sure that those teeth are clean throughout. It will arrest itself, even without doing much. But also now, the reason we keep insisting to go and see the dentist is because the other procedures done that like applying the fluoride, pits and fissure sealants, just to make sure if the child has very deep fissures, the ones we were having a check on in this model, we close them up before they form those decay. Yeah.
And is there a way, now that you're talking about decay, is there a way we can reverse a child who has tooth decay? Or the only option is to lose a tooth?
No, we are not at any point losing the tooth.
Yes.
We say that if you were able to come in early stages, of course now there are other things we say it's beyond repair, you come when the tooth is all gone. So at that point we just have to remove. But our advice is, if this child, you bring them earlier, even before they have these issues, and we detect there is cavity, we are able to prevent that cavity from becoming even more severe and do a filling on that cavity. Yes.
Okay. Yeah. Thank you. I'm hosting Ruth Gasheru Mugaya, dental specialist. We're focusing about your dental health and hygiene in your children. My name is Grace Motiso, your host. You're looking forward to interacting with you on any question that you have. Our SMS line is 22232. Let us know what question you have. We'll be glad to answer you. So what are some of the myths you've had when it comes to, teeth, manenos, in children and even adults?
In children, yes. And just before I talk about the myths, I've just remembered something.
Yes.
That if you had asked me what to do if you notice something is off, bad breath. Yes, if you notice that your child has a bad breath, that's also a sign of tooth cavity. Yes, or gum infection.
Yes.
Yes, and sometimes bad breath, you yourself, you may not have an idea you have it. But it's good to keep checking the
Yes.
breath of your child. And actually, that is so common. You can notice it faster than you can notice that a child has a cavity. Yeah. So myths. Here we go. Many of them.
Yes.
One that you talked about, that when you when you do the professional cleaning from the dentist, you'll have sensitivity. Okay, that's a myth, because what happens, the reason why people have sensitivity is if your disease has gone now to the other severe stages and it has affected the gum. So when we remove that dirt, the gum is left open.
Yes.
So that now at that point is where you feel the sensitivity. But we don't want to get there. We want to make sure that your gums are healthy, are intact.
Yes.
So bring them to the dentist, let them clean them, let us wash them when they should be, and you'll avoid that issue. Number 2, when we are doing that cleaning, we don't, scrub or we don't remove any part of your tooth. We only deal with the dirt. Yes. So the other thing people say is that dawa ya meno ni kung'oa.
Meno kikusumbua, especially when it gives you a sleepless night.
Yes.
Yeah.
I think that's something we are really battering with here, that everyone knows if you have a toothache, you have a tooth issue, is the only medication or the only treatment is extraction. But not that. Before we get to extraction, we can prevent, as we said. Those teeth can be filled, they can be done a root canal. And the way God created your teeth, it's important they function as they were created, because each tooth has a partner.
Yeah.
Each tooth has a partner. So when you break or you remove that partner, so the other tooth, I get to realize, there is no partner here.
I've been left alone.
Have been left alone.
Yeah.
And those people who have removed their teeth long time ago, they can attest that tooth that has no partner is longer than the others, because it's trying to wonder, where is my partner? Basically, because of the mastication forces that helps you to chew, it pushes that tooth. We call it supra-eruption. Yeah, so it's very important that your teeth are partnering. Again, if you remove a tooth, the way teeth eat, there's a force that comes when you're eating, so that they can chew or cut whatever they are doing. So if you remove, you realize that gap tends to close. Now, as it closes, your teeth moves together, and they start now they are erupting. Zinarefuka juu. So you start wondering, what is happening to my teeth? They were all intact, looking beautiful. Now they are all looking like this. It's because of those pieces. That's why we literally advise, if you have to, don't remove your tooth. Just let it be checked. Let it be, preserved. Let it be done what needs to be done. Unless you come to us when there's nothing we can do. We need to do something about that. So the other myth, there are many, but the other myth is when people have pain, there are so many things that people tend to do. I hear some look for batteries, acid for the battery, and they put there. Others they crush avocado seeds, they put there. But if you have toothache, just come to the dentist, and that cavity will be cleaned and it will be filled before you do all those things. I'm not sure I ever had any other, but I'm sure there are so many so many myths out there. I don't know why people fear dentists. They say it's there's a lot of pain, but at least nowadays we have techniques and painless, techniques of injection and all that. So people should not fear. Just come to us. After every 6 months, we'll check on your teeth. If there is something that needs to be done, we will do that.
Okay.
Yes.
Thank you so much, Ruth. So let's talk about what to look out for when you're buying toothbrush for your child.
Yes.
The do's and the don'ts. Because there are so many in the market.
Yes.
So how do you get to know this is the one
Yes.
that will sort your child out?
That will sort your child. Of course, let's check for a toothbrush that is not so soft and it's not so hard. At least a middle there. Because when it's so soft, it will not do the cleaning effectively or the brushing effectively. And when it's so hard again, it will injure the gums. So at least there are those specified for ages. If you can get that, then maybe 0 to 2, 2 to 5, 5 to 8, 8 and above. At least with that is okay. Adults, there are those specified for that. Yeah. Again, on toothpaste, the same. The best thing is if you get the age-specified toothpaste.
Oh,
It's not good if at 0 to 2 years is brushing with an adult toothpaste, because the component that has made that toothpaste is not the same. So you see, for young children, the toothpaste is made maybe with protective measures like fluoride and all that, calcium, enough to protect that tooth.
Yeah.
And now for adults, it's also done with different range of components for that. So if you use for a child, for an adult, that will not. Again, if an adult use for a child,
It can't.
they're also not going the right way. Yeah.
okay.
Yeah.
I know there are so many in the market. They tell you this one will help your child do. Da, 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 da.
Yes.
So how should a parent narrow down to one
Sure.
without mentioning brands
Yes.
or anything? Like, what are the key things in addition to check age?
Yes.
But I can check age. All
Yes.
of them is 0 to 6.
Yes.
But there are 600 of them.
Yes.
So what should I use, like a tip,
Uh-huh.
to narrow down to say pick this
Yes.
over the 599?
Yes. Let's check the component of calcium, phosphorus, and fluoride. At least that has to be there. But again, Grace,
Yes.
this is what we keep saying, that it's like two people. One person is using a soap. Let me say Ushindi, and another one Kipandi soap. If you're given the two, which one would you choose? Maybe the Ushindi, isn't it? This Ushindi person does not take time to do their cleaning or washing of their clothes. But this one with the Kipandi takes a lot of time, does it the best way. You realize that the one who is using maybe the least brand or something of soap is doing a better job. It's the same thing with the toothpaste and all that. You can use the expensive toothbrush. You can use the expensive toothpaste. But if you are not doing the do's and the don'ts the way they are supposed to be done, your teeth will not be in place. For example, if you're using the most expensive toothbrush and toothpaste and you just get into your mouth and within 10 seconds, you are done
You are done.
brushing. You are done brushing, you will not be doing a good job. But there is another person here, maybe even does not have that toothpaste or toothbrush. They are using, the one for stick,
Yes.
or they are using even salt, but they are doing it the right way. They are concentrating. They are doing it the proper way. Their teeth will be in a good shape. So for me, brands is here and there, but if you can afford the best, why not use the best in the market? Yeah.
The key thing is brush
The
tooth
proper
correct
way. The proper way. And the other thing, make sure you go to the dentist. At least we clean the other part that you didn't brush. Yes.
after every 6 months.
Yes.
Okay.
Yeah.
Sawa. Let's talk about quantities of fluoride, recommended for children and babies.
So with the quantities of fluoride, you realize if it's excess, it also destroys our teeth, because you realize there are people who come from places where there is so much fluoride in the water. You know what happens? It destroys the teeth. So maybe 20% of that, if it's there in that toothpaste or whatever, it helps. But if it's now extreme, again, it's not good for our teeth. And I'm sure people in places like Naivasha, Nakuru, all those places will bear me witness that excess salt or fluoride in the water really damages the teeth. And at this point, people ask, what can I do to prevent my child from being exposed to this excessive fluoride? So if you have a young child, a toddler, we insist a toddler, because if you grow in those areas and if maybe you are a grown-up and you go to those areas, your tooth will not be affected. But a child, a toddler who is, her teeth or his teeth are coming in the mouth are the ones who are affected. So make sure that the water that they use to drink is treated. Okay?
Yes.
Make sure that the water that they use in the food, any type of food that they are being cooked for or mixed for, is treated. Yeah. Make sure that any amount of water that they're taking in their mouth, whether it's brushing or drinking or anything, any water that comes into contact with the teeth that are erupting is treated. If you do not do that, those teeth will be affected. And they're not affected when the child is grown up. No, it's when they are younger, when the teeth are coming in the mouth. So that's the most important thing people should note, because I think people wonder what to do. Yeah, it's good if you're in those areas just to prevent that child. You can do that. And again, if they were affected and you are there, you have brown teeth, that's not the end of the world.
I wanted to talk about that. I've heard so many stories about whitening.
Yeah.
You know, and changing the brown teeth to white.
Yes.
In children, is there any danger
Yes.
to that? And is there a right way to do it or any? I'm sure you've seen adverts on
Yes.
social media.
Yes.
A picture of a child with these
Yes.
brown teeth, and
Yes.
within hours,
Yes.
they have turned to as white as
Yes,
cotton wool.
yes.
Eh.
It's possible. There are very many treatments that can be done for that, to that. But now in children, it matters because you see their teeth are still growing. So maybe we advocate from at age, 9, 10, 11, 12, depending how the child is growing. But at those ages, that's when now we can start doing those treatments, because at young stages, again, the teeth are still growing in the mouth. So yes, there are treatments. There is what we call masking, is where we scrap off that affected enamel and we replace with an artificial enamel. There are those which we call crowns and veneers, and they are bleaching also, depending, whether it's mild, whether it's moderate or it's severe. All those treatments are done. So true, if you're there and you have those issues, don't stay there wondering what happened with me. Oh, where will I go with these teeth? I can't even smile. Yeah, we can change those smiles. It's possible to do that. Yeah.
Okay.
Yeah.
There's a parent worried that their child has not, the teeth have not come out, at 6 months. And we talked about teeth,
Yes.
6 months is when
Yes.
they come out.
Yes.
So I wanted to ask, is there a specific age, that is a must, or
Yes.
they vary?
Okay.
Yeah.
Or from the books. We
Yes.
say 6 years, 6 months.
Yes.
But again, as I said, some comes early and others delay. So if the delay is maybe 3-4 years down the line, and now we need to get worried. And you can bring the child and we can take, x-rays and just check what's happening. But if it's 1 year delay, 2 years delay, it's okay, the teeth will still come out. But if you feel like as a parent, I'm worried about this, my child has delayed. Sometimes even we see the age mates, we are like, huyu na huyu amemea wangu.
Na wangu bado.
Ajamea. Yeah. Just as, other children speak fast, others delay.
Yes.
Yeah, it's just delay in milestones, which I think is not something to worry about. But I would rather come to us, we will have a check, and then we'll assure and reassure if we have to. If we have to do some surgery, we'll do that. Yeah.
Okay. So what would surgery entail?
For example, there are teeth. At times you may get a tooth is supposed to come out, but it didn't come out and is hanging somewhere. So there's a surgery done and you evacuate the gum. It's the gum that basically when the teeth is growing,
Yes.
the gums pops.
Yes.
out.
Yes.
When it pops out, now the teeth
Comes out.
erupts. Yeah. So if the gum does not pop out, and sometimes we can see the tooth is here and the gum has not popped out, so sometimes we just help the tooth to come out. Yeah.
Is it a one-day procedure, hours?
It's a one-day procedure. Yes.
Okay.
Yes, but it's good to see specialists because they are specialists for that. Yes.
Let's talk about false teeth or plastic teeth.
Yes.
It has so many
Oh yeah,
names.
that's a myth we forgot.
Is it true that I just got a baby?
Yes.
Na mtoto ako na meno.
Uh-huh.
What happens in this child's mouth? That is it true?
Yes, by there is true. They are there. They come out. It's just the way, I think the hormones overdid. Overdid their work, yeah? So this teeth pops out. But when it comes, I hear some people, especially some areas, they are those people who, wanaitangwa those wazes,
Yes.
the children are taken
Yes.
there, and some blunt things are used to remove those teeth. Okay, if you have them, please make sure that you come to a professional doctor.
Yes.
And they will check on them. And if you are, they have to be removed, we remove them. And if not, we will tell you no. Just stay with them. They are not harmful.
Yes.
Yes, but the others which are harder, and maybe when the child is breastfeeding, they affect and all that. Those ones maybe we may consider.
Okay.
And there are so many things to consider in that. That's why I say, if you have that, if you realize you have a child with those false teeth, don't take them just everywhere and anywhere. Just bring them to a professional doctor. Please get the right advice.
Okay.
Yeah.
Let's tackle a question here again before we call it a day.
Yes.
This one says, hello, what can be done to a 14-year-old boy who, after falling off milk teeth, the others that grew are tiny, sharp, not well aligned, and seems weak? This is from Peter.
Okay. Wow, Peter, that's a good question. If they are not aligned, I think they need to be aligned, because at 14 years, at least that one can be aligned. A bit with being sharp, I think that's just the way God created them. But still, if you're not comfortable with them, they're a cosmetic way of dealing with that. There's a way we can shape a tooth to be the way it should. Yeah, through the materials that we use for filling and that, or crowns and all that. If you're not comfortable, just come. I think the most important thing for me in dental issues is when you have a check on the client or the patient, you're able now to advise most of the issues. But about the being not aligned, that child needs braces, yes, to align the teeth.
Okay.
Very important, because if they are not aligned, you realize, especially in that age, really affects them.
Yeah.
Affects even their education and all that.
Okay.
Yeah.
Braces. See a dentist quickly.
Yes.
Okay. We have to wrap it up, Ruth. Can you imagine? But thank you so much for coming.
Yes.
And you're telling me you have a special training for children.
Yes.
What is it about?
We run a foundation we call Smile Changers Foundation. And this is a platform where we are using to change, to bring awareness and to change and to transform smiles by bringing awareness, especially to the children. So we go to schools, we set up what we call smile clubs, because we are raising healthy smile champions. And when COVID came, we realized there are different ways of doing things. So we started online training, where we enroll children and train them online on Saturdays. Every second and third Saturday of the month, we do this training. So if you are there and you are wondering, what to do with your children, they are not brushing their teeth, you are forcing them, and it's a battle to brush teeth. Just help them. They enroll in that class. We have fun. We teach them the right way to do it, what to eat, how to take a personal responsibility in brushing your teeth. For we believe that when we have healthy smile, we have a healthy future. True. And when we have a healthy future, we'll have a healthy generation. And we can bring these habits into them. We can teach them, and they can love doing this. Most of my champions they say brushing is fun, and brushing is a hobby. And that's what I want every child in this nation, if not the world, to keep saying that brushing is fun, brushing is a hobby. And I'm sure, Grace, that most of these diseases, we will do away with them, and we will help our children to have a very healthy smile. And in the future, we'll have a very healthy generation.
True.
Yes.
With teeth. They grow old with all their teeth.
Yes. So if anyone is interested, maybe they could follow us.
Yes. Give us your socials.
Our social handles. We have the Smile Changers Foundation. You can get us anywhere, Instagram, Twitter, Facebook, and you can call us. We will be able to have your child and train them. And we also have our clinic where also if you have issues, it's called Baraka Smiles Dental Clinic. I'm sure maybe you help us with the contact, just if someone wants to ask a question and all that, and they can come and we will help all those issues you have, all those questions. Please come. We'll be able to attend you. And thank you so much, Grace, for hosting me.
Most welcome.
For me, this is a joy. I mean, when I get an opportunity to speak about this, I do it like there is no tomorrow, because I know that I am helping someone and I'm changing a smile somewhere.
Thank you. Thank you, Ruth. We've learned a lot, and we appreciate you. May the Lord bless you, and Merry Christmas to you.
Thank you.
And Happy
thank
New Year in advance.
Thank you. Thank you.
Ruth.
Yes.
Thank you. She's called Ruth Gasheru Mugai, a dentist specialist, helping us with this topic of today, dental health and hygiene in children. Please take care of them. Check your child's teeth every day, please, and help
And
them
know
to
what
brush
they-
well.
and what they eat
and
also.
what they eat.
Yeah.
Yes, Ruth says also what they eat. And also for yourself. Yeah, we need to grow old with all our teeth in.
Sure.
I've been challenged. I'll be seeing her later for a few things. It's been a joy being with you on Health Check tonight. And my name is Grace Putisa. I want to wish you a blessed evening. Keep it right to your Top TV look and live. I'll see you next time, God willing. Good night and God bless.
Thank you.